Thank you. So we're here in the piano room for another session of Meet the Team with Jackie Colligan, Senior Therapist here at Hay Farm. Welcome.
Thank you.
Jackie, yesterday we were talking about our service being a trauma-informed service. Some of our patients come into us and the first couple of weeks are spent stabilising if they've come to us with a drug or alcohol problem. But then those patients, they do have the opportunity to go on to work a little bit deeper on some of their underlying issues, trauma, etc. Can you talk a little bit about that?
Yes, I can. I work quite a lot with trauma, and obviously when clients come, it depends what they've come for and how long they're able to stay with us. But we are a trauma-informed service, and that for me, as one of the team members, is at the forefront of my role, ensuring that they feel safe, emotionally safe, obviously physically safe, and really paying attention to the information that comes through from the assessment team and the information that's provided. So I look at the pre-assessments, and sometimes we contact families before a client comes in, but I'm actually aware from long before they come in, usually, that they're going to need to have a trauma assessment. And a trauma-informed service might not necessarily mean taking them through any trauma work, but many clients come in and I have to gauge whether they'll feel safer in the main house, in a bedroom where it's ground floor and they can hear people around, or whether they want to be at the top of the house facing outwards, the main house, whether they go into a clinical block, which is actually not very far away. I mean, we can see it from here. All the buildings are relatively close together, but they might feel safer in one of the outer buildings. When they come into the therapy room, if I know that they've had past trauma or recent trauma, I need to know if they're safer with their back to the door or whether they need to be facing the door. And by the time we get into deeper trauma work, if it's appropriate for them, I need to know where they want the furniture moved. It can be quite triggering. We had a client recently who didn't want to be in the lovely garden room because there were too many people walking past the window, and it's beautiful and most clients do choose that room. However, for this particular client, he said he felt safer in a much more compact room where he couldn't see people walking past the window. It makes a world of difference. Encouraging staff not to knock sharply on the door, which not many do, but people are triggered. 1 minute they're all right, the next minute they're not okay. So I'm very aware of that and working with them so they feel emotionally safe and grounded and feel that this is a place where they can begin to look at some of the deeper trauma or abuse or neglect that they've suffered. So yeah, that's...
Thank you, Jackie. It's what I'm hearing as a result of speaking to our staff members is the amount of work that goes on in the assessment process and behind the scenes clinically as a team in order to make our patients, or enable to help our patients to feel safe enough to do the work that they need to do when they're here. Absolutely,
yeah. I mean, we've got someone coming in later today who I'm going to be available to meet. I've known for a while I'm going to be working with that client. I know that they've had some trauma, and I am prepared, mentally, and with a plan in place for greeting them with our lead nurse, Joy, and making them feel as safe as possible, mentally, emotionally, physically, when they first arrive. So yeah, we do learn a lot about clients from the pre-assessment right through until discharge. We help them stabilise and stay safe, and I do work with them when they're ready on DBT techniques for emotion regulation and distress tolerance, and the rest of the team offer. They also offer a trauma-informed service. They incorporate it into their their own practice, not standing up above people when we're talking to them, sitting face to face. If they want to sit across the room, that's fine. If they want to sit next to us, that's also fine. It's very, very client-centred.
Thank you. Jackie, thank you so much for talking to me today. It's been lovely to hear how you work.
Thank you, Lucy.